Welcome, everyone, to Mental Health Warriors. And I'm Dr. Bev Marais from Table Talk, and I'm joined today with a very special guest. We've got Wellness Coach Jackie Yeagley of Mosaic Wellness that's here to join us. And Jackie specializes in the brain-gut axis, and she's here to talk to us about the impact on gut health. So she will be with us in a minute. Welcome, Jackie. There's a really warm welcome to you today. Thank you so much for joining us.
Thank you so much for having us.
11 a.m. your end and 7 p.m. here in the UK. It would be really helpful if you can give us a little bit of an introduction, really, as to a little bit of your story.
So a little bit about me is, I have always struggled with health and wellness issues, weight issues in particularly from a very young age. And I just always battled. I have a backing and a background in medical. I've been probably in the medical profession since I was 18 years old. Just kind of was drawn to it. And, I'm a mom of twins. I'm a dog mom to a Great Dane who's my whole heart. And I've been married to my best friend for almost 20 years.
Wow. That's wonderful. A Great Dane, did you say?
Yes.
Oh my gosh, they're beautiful.
She's kind of my mental health therapy dog, because through my ordeal that you're going to hear about, I suffer from anxiety and PTSD, and we're training her to do kind of deep pressure therapy, and she just has been the only thing that, besides some other things, that has really calms me quickly.
Yeah. And so, Jackie, where did your interest then in gut health begin? How did that develop?
It really began a couple years ago. I had gone through this journey. Should I just dive in and tell you my story?
Yes, please. Yeah.
So, like I said, I always battled my weight. I was always trying every different diet. I've tried, you name it, I've tried it. And about 7 years ago, I decided enough's enough. I'm going to go in and have weight loss surgery. I went in to have the gastric sleeve. And if people aren't familiar with that, it's where they kind of like cut away 90% of your stomach and leave you with like a little pouch or a little sleeve. And before the physician could start the actual procedure, he was already in there. I was already under. A laparoscopic surgery was already underway. My gastric artery got severed, and I started to bleed out in an outpatient surgery center. I believe I lost about 70% of my blood volume.
Gosh.
He had to open me up and convert me to an open procedure where I was split from basically breastbone past my belly button. And there was just so much massive blood loss that he couldn't see what was going on. And he nicked my stomach and didn't know it, and had closed me back up, sent me off to the hospital, road to recovery, start to feel better. And I just wasn't feeling better, but nobody knew why. And it wasn't until about 5 days later, I was in the hospital. The nurse came in to push the morphine. I was on round the clock morphine, and pushed the morphine and walked out of the room. And within moments, I went into what I would describe as like a grand mal seizure almost. It was me going into septic shock. And because I had been leaking stomach acid for 5 days. And so they rushed me back to surgery, where I ended up coding twice. I ended up being in full systemic failure. I came out on a ventilator. I was in ICU for a few weeks. Like, they said that my white count was so high, it was higher than most cancer patients they had seen. I was so sick. And the fact that they had no reasonable explanation as to why I had survived.
Yeah. Gosh, how shocking.
Yeah.
Wow.
So I ended up, I was on medications when I first left the hospital. because obviously the weight loss procedure was not done and completed. So
Yeah.
psychologically, I went through all of this trauma for nothing.
Of
You know,
course.
that's
Yeah.
where my mind was. It was, you know, I'm destined to be this fat girl. I'm destined to be this. I'm, you know, and it really messed with my head. And I got very depressed. I got very, very anxious. I was diagnosed with PTSD and insomnia.
Yeah. Yeah.
And
Yeah.
my stomach basically just was not awake. They had to put me on medications to wake up my stomach. And I got so depressed that I ended up gaining even more weight, completely, defeated the purpose of what I had tried to do.
Yeah. Yeah. Yeah.
Yeah.
Gosh, it's a trauma really in itself.
Yes.
What you went through, let alone the surgery that you were destined to have initially.
Yes. Yes. And so with that came a lot of other things, that I just coping and just to get through life, I just started eating again and I got up to about 300 pounds. And my daughters, I have twin girls, and one of them at the time, they were about 14, I want to say. And she was like, "Mom, why are you so angry? You're so angry all the time." And I was just taken back by that. And I was just like, I just wanted to be better. And here was this 14-year-old girl looked at me and said, "Better than who?" And I couldn't answer her. And it just was one of those moments where I felt so completely broken. And I was just like, she goes, and before I could say another word, she was like, "If you could just see yourself the way the rest of the world sees you, you'd realize you're perfect." And that just really stuck with me. And it was like, here was this kid,
Yeah. Yeah. It's so sad, Jackie, because I think for a lot of people that it's, they go through this where there's this belief that there's something wrong. There's something wrong. There's something wrong with you. There's something that needs to be fixed in some way. You're not enough or not good enough. You're always striving to be better and better. And I know that's some of the messages that we're getting a lot of the time, but how wonderful for your daughter to be able to reflect that back at you.
Yes. And in fact, it touched my heart so much. The next morning I had woken up to a coffee mug that she had gotten me. And it was a bunch of broken pieces that were put together like a mosaic. And it had a Bible verse in the middle. And it basically said he takes the broken pieces and he makes them beautiful. And that's where my coaching business launched out of was, I know what it's like to be broken. I get this, and I want to help people feel better. And that's kind of when I embarked in on my journey of how can I feel better internally about me? Because at this point in my life, I felt like I was destined to be a big girl forever. All these diets failed, this weight loss surgery failed. I'm going to be a big girl. So how can I just feel better? And that's what it became about. And I started doing tons of research into gut health. I started doing a lot of information into inflammation, specifically systemic inflammation, because unfortunately, at the time of my ordeal, and even now, there's not a lot of research and knowledge around surviving septic shock. There is a syndrome, it's called post-septic syndrome, and there's not a lot of survivors. So there's not a lot of, a lot of research out there. And that really affected my cognitive ability, my memory. I'm losing my hearing from it. And it's amazing to see how sepsis has affected so many other people who have been affected by it in their life. But then I also started to look at how food affected us and how food not only affects our mood, but also our gut and our waistline. And so I started looking at inflammatory foods, and I started with the top like allergens, dairy, gluten, soy, eggs, nuts, and that type of thing. And I started just eliminating one at a time. I went to my doctor and I said, I want your blessing to embark on just eliminating different things and see how I react. Because they wanted to do all these tests. And I was like, nope. After my surgery ordeal, if it's more than a blood draw, it doesn't happen. It just doesn't. And I found a doctor that was amazing in working with me and my fears. And she was like, yeah, go for it. You're in good enough health. I was having some amazing terrible issues with my gut as far as my bowels. And I was told that I would probably have liquid bowels for the rest of my life just based on the trauma to my gut.
Yeah. Yeah.
And so I started just playing with food, and I started with one thing out of the gluten category. I don't know why I picked gluten, but I did.
Yeah. Yeah.
And I picked one item. I didn't start with every piece of bread, or I didn't start with this. I started with one thing.
Yeah.
And went through a week, and I was like, okay, how do I feel? And then it just spiraled from there. And within, I'd say it took me about 2 years, I found out I was intolerant to gluten and dairy, and I lost 105 pounds on my own.
Wow.
Just from food,
That's
not
incredible.
exercise,
Yeah.
no quick fixes, nothing. Just
Yeah. 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 It's interesting, you know, with the mood and gut health as well, because, you know, when your daughter said that to you, oh, you're so angry. Why are you so angry? You know, and you were talking about how if you'd gained more weight, it meant that you were eating sort of more, and the foods and stuff that you might have consumed and everything would have directly impacted your mood and how you felt about yourself. And it sounds also like you're saying, if I'm getting you correctly, Jackie, that you got to a stage where you then had to accept on some level that, you know what, this is really where I'm at, not sort of fighting it necessarily so much. This is really where I'm at. That sort of then gave you the impetus to now what?
yes.
What can I do next?
Yes,
Yeah.
exactly. I found that I started to feel better. And then when I felt better, I wanted to do better. And then when I started feeling better and doing better, I slept better. And then I woke up better. And then it's just like I created this whole other cycle. And I realized that as the weight was coming off, it was a side effect of feeling better.
Yes. 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 So even though none of this is about weight loss or diets or, you know, in that respect, it was really about taking care about what your body needs and what works for you.
Yep.
And that sounds like it's more of an individual. There's not a sort of a one size fits all.
Right. It's definitely not cookie cutter, and wellness isn't. It's very individualized. Something that works perfectly for me may not work perfectly for even my own daughter, because she's a different person. And I always like to compare that to people. Is here I have twin girls. You think they're exactly the same. They're mirror image twins. They split from each other. And they are completely different. One will eat something and break out, the other one won't. So it's very individualized, and it is not a one size fits all.
So it's absolutely just what you said there a moment ago. It sounds like, you know, just even with hormones and hormonal imbalances, how all of that then impacts what it is you're eating and putting into your body. And
Yes, absolutely. And so I ended up, you know, I had lost all this weight, and a massive amount of weight, but I was still massively unwell, is what I tell people.
Yes.
I had lost 105 pounds. I was still on 4 anxiety medications. I was still on an antidepressant. I was on blood pressure medicine. I was still not well. I lost weight. I looked better, but I was still insecure. I was still uncomfortable in my own skin. And then it amplified, because then I was dealing with, what did my daughter call it? Like, not imposter syndrome, but body dysmorphia. I'd walk into a store and I still gravitate to the plus size clothing. I still wear clothes where I want to hide myself. And that took a long time to work on. And it's definitely not an overnight process. It's definitely putting in the work and showing up every day, because it's just these tiny little steps.
Absolutely. I was just thinking about someone who said to me the other day about that, you know, they lost quite a lot of weight, and it hadn't even occurred to them to change their wardrobe, to look at different clothes, and realizing that the sort of the clothes was really hanging on them, and they were doing all sorts of things to sort of keep it on, but not really realizing actually just going shopping.
Right,
And
exactly.
changing something. Yeah.
Yeah. And so I started just like, you know, I just wanted to feel even better, you know, and I found, and I started helping people with their weight loss goals. I started coaching people, and sorry, I'm outside. There's a garbage truck going by. But I saw my husband wasn't feeling his best. And of course, you know, we never are the ones that need to be fixed. So I was in this group for health coaches, and there was this whole thread on gut health, and and feeling better. And I was like, oh, he needs this, not me. He needs this. And so,
Mm-hmm.
so I ended up developing this amazing friendship with this other health coach who had shared this stuff with me. And I got it home and he was like, nope, not doing it, not doing it. And so I'm like, well, I'll do it. And within 2 weeks, and I'm very anti gimmick. I'm very anti quick fix and fad. So when I started taking supplements, I was very skeptical because I was like, oh, I did all this on my own already. I don't need any of this. And within 2 weeks, I started really diving into the connection between our brain and our gut and how it's all connected. And I started this line of supplements. And within 2 weeks, I defied 2 doctors' diagnoses of never having a normal bowel movement. I had a normal.
Oh my gosh.
I went from liquid bowels to a normal bowel movement. And then I started feeling better. And it's funny because I tell people I had a life-changing poop and they laugh at me, but I'm like, it's so true because here I was like, I felt like I was going to be broken for the rest of my life. And I felt gross and yucky and all of this. And I felt better. And then it was like, oh, wow. And then I felt lighter and then my mind felt better. And then I just started diving in even more. And being in the medical profession for 20 years, I was blown away when I learned about the connection between the gut and the brain because you're not taught that. It's newer science, but it's, our gut houses 70 to 80% of our neurotransmitters, the happy hormones. So if we're putting junk in our gut, we're going to get junk out. We're going to be stressed. We're going to be tired. We're not going to feel good. And so when I really started honing in on my supplementation for my gut health, everything changed. My bowels changed. My skin cleared up. I had people telling me I look more like my daughter's sister versus their mom. And I didn't lose any more weight with these gut health supplements, but my cholesterol went down 61 points. I'm no longer pre-diabetic. My gut health improved, obviously. My skin's better. My joint pain is better. My hormones are more balanced. It's just, it's amazing how much your gut houses how we feel.
It's so interesting hearing about the neurotransmitters that are kept really in the gut. And I know a lot of people even start their day taking a probiotic and everything to line their tummies and stuff. And
it's really important, and it makes you it allows you to sleep better, because when you sleep better, you get more restful sleep. You wake up and you're more equipped to handle stress. So it makes you more stress resilient. It helps you. I mean, I've gotten off 4 anxiety medications. In the last 2 years, I was able to, with the help of my doctor, I always tell people, make sure you don't wean off of anything by yourself. I got off of Ativan, Xanax, Wellbutrin, and hydrochloro. I can never say it. And it's just, I've never felt better. And that's the thing that so many people are drawn to, is the fact that, yes, the weight loss was great, but I've completely changed my life and my health and the trajectory of my future.
It sounds so incredible. Your whole journey, the story, all of the things that you've learned, and how empowering to want to help others. Really, with this knowledge. So there were just a few questions that has come up. Let's see. Can you please explain what sugary stuff do to our gut?
Sugar?
Yeah.
Oh, sugar is right up there with like candida and the yeast and all that stuff. And sugar makes you want to have more cravings. And when you implement really good biotics in your gut, and I actually have one that I take that's 4 different strains. It's never been done before, but it's a quad biotic. It's a pro, phyto, and postbiotic. So it helps with bloating. It helps with cravings. It helps just reduce all of those anxiety, because, and I say it all the time, our food affects our mood. Well, supplements go in our stomach too, so that affects as well. And the nice thing is that the brand that I use, it's methylated. So even the people that are diagnosed with that MTHFR gene can absorb all of these more fully, which means you're going to get more effect. And the longer you take them, your results are kind of stacked, and you get phased benefits the longer you're on them. So I find that my sugar cravings totally went away. I very rarely crave sugar. I was a diet soda lover,
Yeah.
and very rarely ever crave one. If I have one, it's because it's just more of like the nostalgic, I want to have
Mm,
that soda.
mm.
So when you control that gut environment, you put the good stuff back in, it takes over, and you don't want the bad food, including the sugar and that type of thing. And as you create a healthier microbiome, it all changes. Your microbiome affects your metabolism. It affects how you feel, how you process food. It really does. It's the hub of everything.
Wow. So, so it sounds like one of the things that you're then recommending is, I know you said you started by eliminating one thing at a time to figure out what was working, but then the next step sounded like it's supplements, it's supplementation.
Yes.
Um, because we can't manufacture that ourselves within our body, we're needing additional supplements.
Right. And most of our food anymore is depleted of nutrients because it's so
True.
overly processed. And
Mhm.
at least in the US,
Mm,
I know
mm,
the US doesn't have the greatest food system compared to other countries, but we
mm.
have so many pollutants, we have so many pesticides, we have so many different things we can't get all of those nutrients from our food anymore because everything is so depleted. Even
Mm.
animals, they eat less quality food, and then it gets passed on to us. So there's always that trickle effect.
Yeah, yeah, yeah. And so, in terms of people coming to you, then, Jackie, so they would be coming to you if they are unhappy in terms of body image, also digestive
Yep,
problem.
I pretty
Or
much. I love to help people get their gut health on the right track.
Mhm,
If they are dealing with anxiety, depression, weight loss, those are kind of my key things. Is to kind of, if you're looking for weight loss, it's more mindset than it is what we're putting
mm,
in our mouths, because when our
mm,
mindset's better, we make better choices. And so a lot of times it's
mhm.
a deeper underlying rooted issue as to
Yeah,
why you're grabbing that bad food, and then
yeah,
you feel bad, and then the cycle continues. So it's a matter of stopping that cycle and reversing it. And we do that through mindset work,
yeah.
support, food, and supplementation.
Okay, so because that also answers, there was another question. What's the difference between experiencing gut health and living with an eating disorder? And actually, what you've just said makes sense to me a little bit, because when people, particularly if people are struggling, say with binge eating or even bulimia type illnesses and everything, there's all sorts of chemicals that they're putting into their bodies that then trigger the cravings really, and wanting more and more and feeling really out of control, which
Yes.
then impacts body image and weight and stuff, and then they're sort of coming into treatment.
Yep.
But so it's really fascinating hearing about, actually, because very often people come into treatment because they're wanting to change their eating. They just want to stop binging or stopping da, da, da. But actually, as you say, there's all sorts of other things that are going on really underneath that, where they are very often sabotaging
Yes.
themselves. So there's this ambivalence, the wanting to change and do stuff, but actually what they're doing, or some of their thinking really about it, is really shutting that off.
hmm And it's funny because even my husband and my kids can tell that, like, if I'm having an off day and I become that angry mom again
Yes.
or whatever, because it happens.
Yeah.
Um,
Yeah. Of course.
they'll come up to me and be like, "Did you eat XYZ?" And I'm like thinking about it. I'm like, "Oh, I did." Because it's like, even though I have intolerances, and this is one of the key
Mm,
things I tell people that I do work with, is
mm,
it's a choice. It's not a cheat. You have to
mm.
take away the negative, because if it's a negative, oh, I cheated, then you're setting yourself up to feel bad. You were bad. You
Yeah.
weren't bad.
Yeah.
I never once I figured out what foods worked for me, and that in itself is a process, because
Yes.
when I do it, it's like I eliminate it and then I reintroduce it, and it's going to be something like you don't realize. If I drink too much diet soda, 3 days later, I have massive, massive stiff joints and joint pain. And
Oh,
so
yeah.
it's funny. You have to figure out how it affects you. I tell
Yeah.
people all the time, I can eat cheese pizza. I choose not to, because I'm
Mm,
gonna, I eat gluten and I get more of an antihistamine effect. I'll sound like that, and then I
yeah.
get massive joint pain. If I
Yeah.
eat dairy, I'm back to having massive gut problems. But all of it, I turn into a raging, not fun person.
Mm. Yes, the whole mixture.
Yes,
How
yes.
fascinating. How fascinating. Um, Yes, I know there was a comment there here that says everything is a choice.
Yes.
Yeah, yeah, yeah. Okay, so just sort of rounding up then, Jackie, what would be the message that you'd want to give people?
I love to tell people that anything's possible. You're possible, because when you look at the word I'm impossible, you just take one little fleck at the top and it becomes I'm possible. And it doesn't matter how small the step is that you take, because the baby steps still lead up to massive steps along your journey.
Absolutely, absolutely. You know, I really love that. Impossible is I'm possible. It's wonderful. Thank you so much. And if people needed to reach you or were interested in reaching you, Jackie, how would they go about that?
So right now I'm in the midst of getting my website created and updated. I do have a Facebook page called Mosaic Wellness. There's also a Facebook group which is a little bit more active. I'm in that a little bit more,
Mhm.
and it is Mosaic Wellness Coaching with Jackie Yeagley. And I'd be happy to send you the link if anybody wants to join.
That's brilliant. Thank you so much. I really appreciate your time. It's so fascinating. Absolutely fascinating. Thank you so much.
Thank you
All
so
the
much.
best. Thank you. Yeah.